If you have neck pain and you believe that it's coming from your poor posture or simply have no idea why you have it, this video will be really helpful for you. To quickly introduce myself, my name is Mila. I'm a Pilates and mobility coach, and I believe the fitness world has done some disservice to people by promoting the primary benefit or use of exercise as a means to achieve aesthetic goals. Exercise is one of the most powerful tools that we have to empower our body and improve our lifestyle. Therefore, its primary function is our well-being. Aesthetic benefits of exercise are just a great byproduct of feeling better and stronger in our bodies. With this said, I'm so happy to be joined by Samya Tatone, who is an osteopath as well as a Pilates and yoga instructor. Today, we're going to cover the hot topic of posture, specifically relating to understanding neck pain, spinal health, and recovery. Hi, Samya. I'm so happy to have you here.
Hi, Mila. It's very nice to be back again. Thank you so much.
So on the topic of neck pain, I wanted to go through a couple of questions just to get your understanding and your background with your profession as an osteopath as well as a movement facilitator. So if you don't mind, I'll just jump right in.
Sure. I mean, neck pain is a big topic for sure.
Definitely. So as you mentioned, many people suffer with neck pain.
Yes.
And many assume that it's simply due to poor posture. What are some reasons for someone to suffer with neck pain other than posture?
Well, neck pain, a lot of people suffer with neck pain for many, many reasons. I mean, the most classic is posture, and everybody thinks it's, oh, my head is forward, I have bad posture, I should put my shoulders back, and things like that. But we have to remember that the neck has two part functions, of one being the top end of the spine, right? So it's sitting on a structural tower that really needs to be well integrated for it to sit straight. But it's also our connection of our head to the spine, right? So it's we're going to have all our five senses that actually relate to the function of our neck and vice versa. Our eyes dictate which way our head turns. The way we breathe through our nose has a function structurally with the head and the top cervicals of the neck. Our ears, how they hear within the skull bones and how they sit on the neck. How we chew, our tongue function is related to our neck. Our jaw, how it sits on our head, so the TMJ problems, extremely related to the health of the neck. And I can keep going. Even your heart function is related to your neck. So yes, just to try to simplify as easily as I can, we have our habitual movements of turning our head always one way, either to look at a screen or depending on the jobs that we do day to day, our habits. If we're always carrying a baby or a bag on one side. So we have to check our habits as well. But also shoulder function. Like right now, I'm actually going through a frozen shoulder. And that's impacting actually my neck, because to be able to raise my arm higher than a certain position, I have to kind of go into my neck muscles to actually get my arm up higher if I want to reach something up out of the cupboard. That will heal, obviously, but in the meantime, I'm going to get a little bit of neck discomfort.
Yeah, I feel that poor posture has over the years become such a go-to answer to this problem. And
Yes.
you know, I am also reading and learning new things that posture has its role to say. It's not nothing. But what people always push through as poor posture. Sometimes poor posture when you're stuck in an email, it's okay because you're reading something stressful happens. It's the prolonged posture that we hold. Any posture, it can be this posture, it can be
Yes.
this, like anything that we do and we just hold still is going to raise tension. What you mentioned is very interesting, is that there's so much more at play. Even the jaw, the tongue, how we breathe, the eye gaze is so important. And now that you mention it, I'm actually paying more and more attention to when I meet people who have that upper neck pain, how much of a constriction they have around their breathing and their neck. And these are quite evident in some of the exercise, like when I do the eldoas, it's quite evident the jaw contractions, which we might cover later, we'll see. But it's an interesting topic, the positioning structurally, also how it affects what we feel around here, right?
Yeah, because it supports all of that. It has to, the bones of the skull, it's like a jigsaw puzzle, the skull itself.
Yeah.
And even though the joints are, many people like to say fused, there is a very, very mild movement of sort of a breathing action, a little bit like a jellyfish, but so minor within the head. And if that jigsaw puzzle of the skull is not moving well, then it's going to impact how our eyes move. It's going to impact the muscles of the eyes. It's going to impact how our jaw sits. It's going to impact the function of our tongue. So babies that can't latch on, that are born with torticollis, for example. I actually got a whiplash many years ago, and it impacted my swallowing ability. I actually had to get treated for that. What else? Like, even, for example, you were talking about prolonged held postures. Absolutely, chronically held postures are detrimental to the health of the neck. But what I used to work in a physio clinic, and the physio head therapist caught me slouching, and he goes, "Samya, you're a Pilates teacher. I thought Pilates teachers don't slouch." And I was like, I got myself up, right, and I sat tall. And I said, "Thank you for noticing, but I actually can get up. You can't." And that's the difference, right? It's the malleability, the fluid ability to move, or the ability to move fluidically, rather than being stuck in this braced posture where you can't get up because you're so stiff, right? You need to have the muscular tone, but also the mobility.
Yeah, so that's a really good point, is being able to get out of that position, whatever it is that we find ourselves for hours sometimes.
That's right.
How does health of the rest of the spine impact the health and mobility of the neck? Because you touched on that at the very beginning, so I'd love for you to tell me a bit more about that.
Yeah, so I drew a little, I don't know if you can see this. It's my Stickman famous drawings.
Oh, I love it. Okay, that's fantastic. I can see that.
So head, spine, pelvis, let's say, right? So if we have a look a little bit at, even though the spine here looks really crooked, if my head is on top of a straight pelvis, my spine, because it's many vertebrae, will compensate for being straight aligned, unless I'm tipping over like the Tower of Pisa a little bit more here, where we're seeing the pelvis is actually slightly inclined or tipped to one side. And that doesn't only create deviations, but now we're starting to see rotations through the spine, and then the head at the top has to compensate for those rotations. So we need to be structurally integrated, literally from our ankles all the way up through the hips into the pelvis, all the way up through every vertebrae, which is going to adjust themselves one by one so that our eye levels are straight. So if you have a scoliosis or whatever, a crooked pelvis, or one leg longer than the other, or just one foot that collapses in the ankle, that's going to throw everything off. But the brain says, no, 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 I need my eyes straight so I can function, so I can walk, right? Or look at something, or whatever. So if my head is tilted here, or my body is tilted here, my head is going to correct itself just to keep my eyes level. So now I always have this sort of kink in my neck that's chronic. And then we complain of neck pain, and then we go to the physio to fix our neck, and they massage, and oh, your shoulders are tight. So you fix the neck, and oh, okay, now I'm crooked all the time. But the brain's going to say, but now your eyes are here. I got to straighten them up. So you go back to that, and then you got to keep going back to the physio or massage therapist to massage the neck. So no, 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 no. You got to go all the way down, fix the ankles, footwork and Pilates, fix the hips, level out the pelvis, align the spine structurally, one vertebrae stacked on top of the other, remove any rotations so that your head is not stuck compensating for what's going on below. And then your jaw will hang better. For example, TMJ.
Yeah. That's an interesting, because it's almost like a losing battle if we're looking at neck pain from a perspective of just highlighting this area, and one of the big things that I really I find frustrating with social media and advice on social media is these quick fixes like stretch, you have neck pain, do this, and it's like a neck exercise, and it doesn't take into account exactly what you have just said. And from my experience also in as an instructor, Pilates and mobility coach with my clients, I often find that when addressing the neck, I am so much in the thoracic spine. I'm so much going down into, at times, lumbar. Sometimes, like as you've noticed, and I've seen this, is the hip structure, the way that the hips are sitting. And this concept of neck pain, let's do neck, is a losing battle. And now I understand why, because if we're talking about massaging and releasing tension and doing that sort of work on it, our nervous system, our body will continuously bring us back and will continue to have the tension unless we address the spiral going down that you explained, or the line going down that you explained.
And also the curves of the spine, the natural curves of the spine going front to back, right? So scoliosis would be a side-to-side curve, which is dysfunctional, let's call it, even though many of us have some form of scoliosis. But the front to back, so your lordosis, kyphosis, and then lordosis again in the neck. So for example, ballerinas who are always told to tuck their tail to stay straight, right? Bring your bum, pull your bum in. They end up with a very flat lumbar curve when there should have a little bit of a curve. That curve is vital for the transfer of forces, right? From the feet up into the spine. But also it's an amortization. So you're actually bringing the spine to its springiness, to absorb energy and to give energy back. So that is vital. Those curves are vital for that. So the neck follows the lumbar lordosis with the kyphosis. If your kyphosis is too stiff or rigid, you're going to have an increased lordosis in the neck to be able to compensate for that. So it's very important, like you said, yes, that thoracic mobility, upper back, to be able to free the neck, for the neck to be able to sit straight, but also that lumbar curve, you need to have one that's natural, neutral to you. Everybody's different with their curves, so that the neck can actually have its natural lordosis. Absolutely. It's like a wave.
You mentioned with injury, and you mentioned that you had whiplash in the past. What if someone actually has a neck injury, such as whiplash or trauma or an accident of some sort? So my question is, how would working the rest of the spine help them through a specific injury?
That's a good question. Because again, even with concussion, for example, even though concussion is a way different topic, it's related to how the neck responds. Remember that we are a network of fascia, right? Everything is literally connected. So I can move my big toe and I'm for sure going to have an impact in my ear, like it goes without saying. So when we injure the neck, all of a sudden, I'll give the example of a whiplash, acutely close to the actual event, your neck muscles are going to brace and protect you. So you need that time of bracing so that the body can do the healing that it needs to do more deeply internally. But in the meantime, you want to make sure that you're working or maintaining at least mobility and alignment and structural integration throughout your system because of all the fascial connections. So if I'm bracing and really tight up here in my neck, it's going to have an impact on the fascia that goes down into my throat, into my heart, into my diaphragm. Think of the vagus nerve that runs from the base of the stem of the brain all the way down the neck through the lungs, the heart, into the diaphragm, into all your visceral organs. If I'm bracing here, I might have a digestive issue that's related, for example. So I need to make sure that everything else is moving freely while that is healing. And then to make sure that I'm also very slowly, as I improve through my rehab, making sure that those bracing muscles are starting to learn to switch off while I strengthen the more integral muscles, the core muscles of the area, but also making sure that that is supported by its foundation being lower down below, right? The feet, the hips, the core, lower back, spine, rest of the spine. And we often forget the relationship of the muscles of the neck to glands, organs, right? We have our thyroid right here, a lot of thyroid dysfunction simply because there's a neck dysfunction. It's not just an organ problem, it's a neck problem, right? What else? Herniated discs. Again, you're going to have a lot of bracing in the neck just to protect that disc, but that disc is being squished. Nerves are being pressed on because of the malalignment. So if you can work your structural integration again, and all the fascia that's connected all the way down to balance the tensegrity of the system, tensegrity being the balance between push and pull, tension and compression, then you're going to start to take the pressure off the disc, and the body knows how to heal itself. It's literally going to pull everything back into its homeostasis. You just have to give it the right posture, the right alignment, the right environment for it to do that.
When you speak of the muscles bracing, and for somebody who has neck pain, would you have any? I know that it's so hard to give generic advice or even exercise recommendations because it's so specific and would have to look at several things. But if somebody's experiencing neck, what are some of the first things or advice that you would give them to start releasing some of that tension? Basically, my question is for somebody, pardon?
Breath work.
That's a very good one. I actually had that in my mind as I was asking that. For somebody who is in pain and is, because when pain happens, it's not, there's stress on the body, there's tension in the mind, and there's a lot of stress that comes from pain that causes stress that causes other pain, and it's like this vicious loop. So for people who are stuck with some neck pain, what are some of the things that they can start doing daily? I know you mentioned breath work. Is there anything else to help them release or start calming things down a little bit?
Definitely breath work, for sure, because we want the diaphragm to start to move a little bit more freely down, so you're not breathing from the neck, because that vicious cycle, which is a very good point, of pain brings us into this anxiety and worry and stress, right? So if we're breathing more apically from the get-go, we're really using our neck muscles to pull air into the top part of our lungs. So number one, turn those off. Tell the diaphragm to do more work so that our rib cage is starting to move. Right away with the rib cage movement, the upper back thoracic spine is going to start to gain a little bit more mobility. They'll be able to lift the breastbone, extend a little bit more, therefore already taking pressure off. The other thing I would say, which is a go-to, is to release all the what we call suboccipitals, which are the muscles at the base of the skull related to the first top vertebrae of the neck, right? Just to simplify. So try to just release tension, either go get a massage or see a therapist of some sort who can do a gentle release there. Do some cranial work if you can with an osteopath or a craniosacral therapist. That's a good start. In yoga, they are great with a lot of throat opening exercises. So where you're sticking the tongue out quite far, opening the jaw, rolling the eyes up, that they call it the lion's pose.
And that helps with the neck, of course, because you mentioned at the very beginning how the jaw, the tongue affects.
The tongue is literally attached to your first and second vertebrae of the neck. So when you throw your tongue out as far as you can, you're actually mobilizing the first and second vertebrae of your neck. So that area where we also get a lot of tension just with headaches, migraines, so on and so forth, releasing the top here is a huge, huge release for the nervous system itself. and that can impact how you feel.
And
Yeah.
what about the shoulders? Do you feel that they also have a role to play in neck pain? And would you advise movement? I know we talked about going down and looking down at the thoracic, lumbar, hips. How does the shoulders and the arms play a role
For
here?
sure. Just to
Models.
simplify again, basic shoulder rolls. A lot of people do this and it's hardly doing anything, but really pulling the shoulder blades apart, lifting them, squeezing them, pulling them down, making sure that they move in all directions. The mobility of the shoulder and the shoulder girdle, so collarbone, shoulder blade, arm, should be mobile to free the neck because it's hanging from the neck, right? A little bit. So definitely shoulder mobility is very freeing for the neck. Yeah.
So I like this kind of concept of moving the joints. From a mobility perspective, we have something called controlled articular rotations, and what you explained with the shoulder blades is one of them. It's basically taking your joints through their full range of motion, a full
Yes.
available pain-free range of motion. Even if it's small, you start somewhere and you build up, but you keep moving it. And actually it goes back to the idea of poor posture. Even if we're in poor posture, moving out of that is going to offer release, and that's something that we should be doing more of. There's another aspect that I wanted to just touch base with you and maybe talk and demonstrate it at another point, but decompression techniques or a way to create more space between the vertebrae. So if we're talking of something like a herniated disc, being able to release tension in addition to mobility, right? Because if we're stuck and we're just going to jam back, it might not feel as good for us. It might actually trigger some pains.
You could
So,
also be making it worse as well. You have to be
yeah,
very careful.
yeah. So with decompression, do you, as an osteopath, look at it both as manual work and exercise that you incorporate, or do you stick to more manual approaches for creating space within vertebra or within the spine?
I always like to put the power back into the client's hand because they're in charge of their own health. So not me and not anybody else. If they give their power away, they will stay sick or injured or whatever. So I always try to teach how they can help themselves first. And the Eldoas, for example, are phenomenal to decompress the neck. And also, just as a side note, I have a cousin, for example, who lives all the way out in Alberta. I'm all the way in Quebec, so it's like from here to Europe. And she called me. She's a dentist, always stuck in the same posture, rotated one way, and she had numbness and tingling going down her arm. So being her cousin, she calls me and she says, "Can you help me out any way possible?" And so I gave her a few Eldoas to do. We did a Zoom session together, and within a week, her numbness and tingling had diminished dramatically just because of that idea of decompression, right? It was taking the pressure off the discs, off the nerves, and all of a sudden she can function again. And so, yes, teaching the client first. When we see that it's not working, or maybe not working to the speed that we would like it to be, then yes, manual therapy is definitely helpful. It definitely speeds the process up. Very helpful also for feedback, because having a manual therapist work on you, the client becomes aware of what's going on in their body as well, and then you can then hands-on teach them a little bit more specifically how they can help themselves.
Yeah. I like the concept of empowering. I think, as I mentioned, exercise is a way to empower our bodies to live better. So the idea of somebody knowing how to help themselves is so valuable through techniques that, truly address the health of joints. And we're not talking quick fixes. We're talking, commitment to exercise that improves your overall well-being. We can't improve our neck if we don't improve our upper back, lower back, hips, as you mentioned, all the way down, depending where those imbalances are interfering with our health and well-being, need to be addressed. And so the idea of a quick fix or a quick stretch, as often conveyed and so popular on social media, is I find that it harms or disempowers the individual on the other side, because it's hard to say, don't look at social media as informative, just look at it as entertainment in theory. But in practice, that's not what happens.
Yeah.
So the idea of empowering someone and teaching them about their body is so much more effective and so much beneficial. And it's not as clickbaity, but it is the things that help people live better. And I think that's a really important thing for us as movement professionals to always consider when talking to our audience, virtual or in person.
I think that's a very good point, because like you said, mentioned before, that fitness and health has put its focus or emphasis much more on the fitness than the health. So we have people that are running marathons and are super fit, but they're sick. They're not healthy, right? And so I like to remind people as to why are they exercising, right? Are you trying to get fit for something specific, or are you trying to maintain your health and thrive as you age, right? So you could be super fit but have a really poorly structurally integrated spine, and your organs are going to start to fail because the nerves can't get messages or to the organs, arteries can't get the blood flowing to the organs, and then you get sick. So no, let's move with the mindset of or intention of maintaining health, maintaining function, making sure our heart is working properly, our lungs are working properly, all our organs are working properly. And the health of the neck is so important for the communication from the brain to the rest of the body. Yeah.
Yeah, that's a really interesting topic. Thank you so much, Samya, for your time. I found this super insightful. Thank you for sharing your experience and your examples. I always feel that personal examples help others to relate in case they have something similar. So thank you very much. I really appreciate your time, and we'll chat again in the future, I'm sure.
You're very welcome, Mila. It's always a pleasure.
Bye, Samya.
Thank you. Bye.